Hey everybody, Dr. Leo Krawetz, Healthy Feet Podiatry. Gotta give a shout out to Tobro on this one. Why? Because this patient came in because he watched the Tobro show. And he said he did not know that podiatrists or chiropodists even existed. So he came in specifically to have his nail removed just because he saw the Tobro on TV. That's the Tobro. He's got a YouTube channel from what we heard on YouTube as well. And he's got a big audience like us. Gyro, what are you doing? Thanks, Gyro. Guess I'm talking too much. Come on in the room. Follow me and check this out. There's the wall, too. Okay, here we go. Come on in, Alexia. Okay, so this is our toe. This is our patient who saw Tobro and figured out that podiatrists exist and that we can take his nail off. So you saw an episode, I guess, of one of his shows and decided, hey, it's time for me to get my nail removed?
Yeah, exactly. I mean, I've had this thing going on for about 5, maybe 6 years.
Okay.
And it just developed from this to like ongoing hangnail to back and forth, and then I've been like dealing with it for a while with, you know, just combination of over-the-counter topical treatments to Dremel tools.
Right.
To
This one here in particular, if you look at this
Yeah.
one, Alexia, see this one's really bad, but the one on this foot is actually giving him more pain because it's growing in two. So I gave the patient all the treatment options that we use, and it's usually either laser, which has a 60% cure rate, pills, 38% cure rate, or topical, 10% cure rate. Nothing works great, but laser works the best. Pills are okay, but they're not that great for the liver because they can affect the liver. So this patient, after watching someone's nail removed, decided that that's for him. He wants his whole toenail removed. He wants to skip past the laser, skip past the pills, and yank the nail out. So that's what we're gonna do today. So I gave him a little bit of numbing medication, but I'm gonna give him a little bit more. He has to work tonight, so he works nights. And what we're gonna do is we're gonna inject actually some Marcaine plain, which has longer anesthesia. So he'll be numb for 8 to 12 hours after this shot here. So he should be a little bit numb right now, but I'm gonna show you how we numb it anyway. When we numb a toe, the whole toe, there's 4 quadrants. So what I'm gonna do is spray this a little bit. He's probably pretty numb. Right up here, there's a digital nerve. That's the dorsal medial nerve. And then there's the plantar medial nerve. Do you feel that at all right there?
No.
On the bottom of the toe. So we're gonna drop some of the medicine down there too. And I'm gonna go a little bit distal, but not that he can feel this because he's pretty numb. And then we're gonna do the same thing over here. We're gonna drop this on the dorsolateral nerve. It's the dorsolateral digital nerve and the plantar lateral digital nerve. And we're dropping medicine as we go. And then I'm dropping it as I come back up again until it's done. So now he should be nice and numb. We can see where the anesthetic is around the toe. If you don't get all 4 nerves, it's not gonna be numb. The main nerves, believe it or not, are the plantar medial and plantar lateral nerve, because that gives most of the innervation and feeling to the nail itself. So if these aren't numb, sometimes the nail won't be numb. And we're doing the whole toe. So when we remove the whole toenail, that can be more sensitive if those plantar nerves are not numb enough. So you should be numb right now. So we're gonna put a tourniquet around it. And I have my own technique for removing the whole toenail. Some people like to free it and then pull it and try to get it out of there. But what I like to do is get as much blood out of this toe and keep it as dry as possible so I can see everything that's going on. And I do that by exsanguinating the toe and then putting the tourniquet on pretty tight at the base of the toe. A dry field is great when you're putting the chemical there, and it's even more important when you do a total toenail because if there's a lot of bleeding with it and the chemical doesn't take, you get nail spicules. So you'll actually get little chunks of nail that grow, and that's kind of annoying for someone afterwards because it sticks on the sock and we have to do the procedure again. So we're gonna make sure this is nice and dry. So what I do is I free up the nail here, and if you get real close there, Alexia, we can get a close up. Can you see it from there?
I'm seeing, yeah.
It's almost like watching your own TV show live.
Wow.
Yeah. Okay, so we're freeing this up right now. There is some bleeding, but that's leftover blood. So some of the blood still gets pushed out, but you'll see how dry I can get this usually after the leftover blood is pushed out of here. Right now I'm freeing it up under the epinicium. And I know some of our fans out there like the word epinicium. It seems to be the favorite word. So our word of the day today is
Try saying that
epinicium.
3 times fast.
I'm going to see if I can say. So you can actually play games around this, and every time I say the word epinicium, isn't there a drinking game called epinicium and drinking or something like that? Yeah. Every time they say the word epinicium, or is it,
Take a shot?
stuff? Yeah, I guess so. Yeah. Something like that. But you can do any game around the word epinicium, or you can impress your friends and just throw it into a sentence randomly. Epinicium. Okay, so we have it freed under the epinicium, and now we're going to take the curved hemostats under the epinicium. This is my technique where I go under the epinicium, and I've got a curved stat, so it's actually hugging the nail plate itself. Can you see that up there?
I sure can.
Okay, and I'm going to flip it around, so I'm hugging this nail plate underneath, and I can actually feel the underside of the nail plate. And as I push this under here, I can free it up by spreading the hemostat. And this is kind of brutal looking actually. But as I do it, it slowly spreads out. And this is great because I'm spreading this out. Cool. And you can see it, you see almost the wings on it.
Yeah.
That's the edge of the nail. And you're okay up there, right? It's not freaking
perfectly
out?
fine, yeah.
Okay. Because this is the kind of stuff that freaks people out a little bit.
Not in the least. I was in the Army for 9.5 years, so
okay.
this is like, whatever.
Nothing for you.
So this was, you guys did this on a daily basis to the enemy,
it's like,
right? Is it
blood.
Wasn't this like the enemy torture? Put stuff under their toenails? Okay, so anyway, so I'm near the end. I'm watching if you look, when you're close up, can you see the end of my stat?
Yep.
Under the nail. You see how it's near the end of the nail? That's about as far as I need to go. Now I'm going to spread this again. And you can see as I spread it, it wants to go that way. That's the path of least resistance, actually. This side's still a little bit tight, so I'm going to spread it over this way, too. And I'm slowly spreading it. And you can see that nail's actually coming off already, just from spreading the hemostat. Okay? So I'm going to grab under the nail here, and I'm going to clamp this side, because this side's the side that's actually still on there. And I'm going to slowly pull. And here we go. We're going to slowly pull this off. And the key is trying to keep that nail bed intact. You can see this right here. That's just from the nail itself because the nail is so thick right in that part on the underside. That's where it's actually, the underside of the nail has damaged the nail bed. So I'm going to pull this off, and this is all callous skin right there. And we'll get all that off of there. And that's the nail.
Wow.
That's it right there. It's a big chunk of nail. Pretty cool, huh?
Nice.
The underside of the nail, you can see where it's real thick right there. That's part of the problem. That's digging into your nail bed. And then the nail's curved. And you can see how that would be problematic. A curved nail like that, it's actually going this way, digging into the side of your toe this way, digging into that side of your toe. So now it's the cleanup. We're going to clean up this mess right here on the side, which is really the callus tissue. And I'm going to pull this off. I could use a tissue nipper there too. But I'm just taking it off like that because I want to get everything that's loose instead of taking good tissue with it and taking the tissue nipper to it. So now I'm feeling it. A lot of this stuff comes off very easily because it's attached to the nail itself or and not attached to the skin. So I'm actually feeling this to make sure this is smooth all the way around. There's a ridge right here. This is hypertrophy of the underlying tissue. Hypertrophy is thickening of the tissue, and it's hypertrophy of the tissue secondary to the trauma from the nail. That will go down with time. I could trim that off of there, but underneath it's so thin that underneath it is actually the bone. So the bone's pretty close. We're going to leave that there, and that will go down with time. So you can see I have a nice, dry, clean field to work with here. Now I can put the chemical there, and this is the most important part. Let's make sure this chemical takes. So we've got our sodium hydroxide, and we're going to put it under the epinicium. We just said epinicium again.
Shot time.
Yay, epinicium. Okay. Set it again. So it's under the epinicium and it's burning the nail matrix. The nail matrix is probably about 5 millimeters in length from proximal to distal. Proximal to distal is this way, proximal, distal. And what you can see it actually burning, it turns it a whitish color. And we do like 10-second sticks. So when I did that, to me, I'm thinking, I got it mainly in the middle. I need to concentrate this next one more on the medial and lateral sides. So right over here, this is the part that usually when you get regrowth, this is the most common part to regrow, is right in the corners right here where we would do the ingrown nail part. So we're gonna make sure we get that, and I'm gonna just slide it over and do a little bit extra seconds on the medial and lateral sides here too, and then kind of slide it across under the epinicium. Set it again. Here we go. That's 2 sticks, so we're going to do our 3rd stick. And the 3rd stick is, I'm going to start in the middle. We're going to concentrate again on the sides too, because we don't want those spicules growing from the sides here. I'm making sure I get it. And the stick is underneath what? Where's the stick? I'll ask the patient. What's it under? Yes! The epinicium. All right. Okay, this is great. And it's actually real smooth underneath there too. Under the epinicium is what I'm talking about, of course. We are going to flush this now. This is vinegar. Vinegar neutralizes the chemical somewhat. It's white vinegar and water. And we're going to do another spray here. And I can smell the vinegar. Smells like an epinicium salad. If we've ever had an epinicium salad, I don't think we have. Okay. That would be pretty disgusting. Now we're going to put the dressing on. Just make sure we've got everything else we need here. Okay. So before I do that, I want to take this off just to make sure that there's nothing bleeding excessively here. So I'm going to take our tourniquet off. Okay, and we're going to see no bleeding from the epinicium. No bleeding from it. This is what I was most concerned about, where the trauma was. Sometimes you can actually get bleeding if it's real deep towards the close to the bone, but this is great. This is exactly what I want to see. We're going to add some Sylvadene cream. Sylvadene cream is antibacterial, antifungal, antiviral. The main thing is we just don't want a bad bacterial infection afterwards. So we kind of slop it on there. It also keeps it from sticking the dressing afterwards. And the great thing is, like I said, he's not bleeding a lot. Excessive bleeding does cause excessive sticking of the gauze, and sometimes you have to soak it off of there. I'm going to be safe here. We're going to add a little bit extra gauze there. And we're going to do one more piece here. Make this nice and cushiony, especially over the epinicium, where it gets a little bit sore actually afterwards because of the chemical. And then we're going to wrap this up. And this is it. So we'll put this nice red dressing on here.